Hi everyone, my name is Sam Ali and this is my final case study on Alzheimer's disease or AD. Introduction of our patient, we have a 71-year-old Janice who's a widow. She lives alone. She is a retired nurse and she's always kept her house clean and organized. Janice's daughter Susan has in the last several months noticed that her mom laundry and dishes piling up, junk mail mixed with unpaid bills lying around the house. She's failing to show up at her location where she volunteers in Community Blood Center. And as Susan is finding out these things along the way. Janice was previously seen by her primary doctor and accompanied by her daughter. There was some blood work and some tests that were done, and her doctor has called her back in today to go over results and to do neurologic assessment and mental status evaluation, which we're going to see the results here in a little bit. History of present illness. According to Susan, her mom has always been a little bit bad with names, but she has noticed this is more than just trouble with names. Janice is always, she's been having trouble coming up with words and names in the last several months, and it has been happening more frequently. She has been misplacing things more often, and several times Susan she had to come and find her things because she was unable to retrace her steps. And again, this is all beginning to interfere with her day-to-day functions. She's also noticed that her mom is having some behavioral, more like emotional changes, which is kind of mild, but she's saying that it's very unlike her mom to have depression or anxiety or have outbursts. Past medical history. Janice has diabetes, she has hypertension, hypercholesteremia, sleep apnea, obesity. She's just a little bit over in the obesity category. But as we can see, there are several risk factors for AD, and this is going to all come together at the end for her diagnosis. Social and family history. When we know Janice is a 71-year-old female, we don't know too much about her dad because he passed away when Janice was just a teenager in a car accident. And her mother died 3 years ago. However, she was diagnosed with Alzheimer's at 70. So, her mom was 83, so Janice saw her mom go through the progression of AD. So this is kind of sad or anxiety producing now that her daughter is bringing up her cognitive function or her brain health. So we can see why this is upsetting to Janice. The clinical manifestations, the ones that are underlying, these are the ones that has been showing in Janice, according to her daughter, and is now confirmed by her doctor as well. The memory loss that disrupt daily life. And we know memory starts in the hippocampus of the brain, and that's where memories are produced. So we start losing those short-term memories. Challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images or spatial relationships, new problems with words in speaking or writing, misplacing things or losing the ability to retrace steps, which has been happening a lot more, decrease or poor judgment, withdrawal from work or social activities, and changes in moods and personality. Well, we know we've seen some of this as we're reading the story or the case study along the way, that these are becoming more apparent. Laboratory and diagnostic test results. There is not a test as of today to say that this person has AD. However, all of the tests and lab results are to rule out other condition in order to or other conditions to diagnose AD. So this includes history and physical, including neurologic assessment and mental status evaluation. MRI was ordered in the neuroimaging, and the MRI showed no tumor. However, there were some mild changes to the brain. Genetic testing. Well, we found out that Janice is a carrier for a gene mutation called APOE4. Now, this is not a definite diagnosis or saying that you have it for sure. There's been people that have had one gene from mom and one gene from dad, and they still didn't get sign or symptoms of AD. However, it is a risk factor and is worth mentioning in this situation, and Janice has it. Other labs that were ordered, CBC to rule out anemia and other blood disorders, UA to rule out UTI, and then CMP and liver enzymes and hemoglobin A1C, along with some other other vitamins, vitamin levels like vitamin B12, were ordered. Everything was normal except for her hemoglobin A1C was a little bit high. However, she does have diagnosis of diabetes, so this is not unusual, and it just could mean that her medication needs to be tweaked. So all the results, unfortunately, shows that Janice has mild cognitive impairment, or MCI, due to AD. It is formally known as early onset Alzheimer's. So this is a new term coined for this. Pathophysiology of AD. We know there's overproduction and or decreased clearance of beta amyloid peptides. And this, the first thing that happens, amyloid plaques forms, which contain fragments of protein known as beta amyloid peptide mixed with other protein, neuron fragments, and other cell pieces. We know cell death happens, so the byproduct just keeps accumulating and clumping together with the amyloid plaques. Secondly, neurofibrillary tangles found inside neurons form an abnormal collection of protein called tau. So these tangles and the plaques, which 100 years ago was coined and mentioned by Dr. Alzheimer's, Alois Alzheimer's, mentioning that this is what was happening inside the brain. These plaques were taking over the neurons and causing cell death. So third, the connection among neurons responsible for memory and learning are lost. So we know the more the connections are lost, neurons start dying, and so the brain starts shrinking. That's where the shrinkage or the atrophy comes with Alzheimer's disease. Here's a figure in this figure that talks about shrinkage of hippocampus. We can see the 25-year-old brain looks nice, and the hippocampus looks very nice, this nice seahorse. And then the normal changes that occur on a 75-year-old that does not have Alzheimer's disease. Then we have the MCI. We can see some changes here. So this would be Janice, and she has quite a bit of change already. So we can see why she's having those symptoms. And then Alzheimer's disease, I guess we can say that end stage of it, or towards the end, you can see there's quite a bit of shrinkage of this hippocampus. Here's another picture that shows us the tangles and plaque kind of taking over the neuron synapses, and basically it's a horrible way that our brains start dying. Pharmacological therapies, there's not a cure right now for AD, and the therapies really don't slow the progression that much. Instead, we focus on symptom management. However, all the researches that are going, they're focusing on prevention. So really all of us, if we have family history, but even if we don't have family history, we really should be doing preventions, which I'm going to talk about some of the ways you can prevent, or things you can do, hopefully, to prevent. Even if you don't have the family history, there's the sporadic episode, which counts for 90% of Alzheimer's. Pharmacological medications like cholinesterase inhibitors can improve neurotransmitter levels in the brain. These are the Aricept, Exelon, and Razidine. So her doctor prescribed Aricept for Janice, and also Namenda, which was originally approved, or is still approved, the only medicine approved for AD originally, to help with symptoms. So what the Namenda does, it blocks NMDA acid receptors, and other medication helps control the aggression. Well, we know antidepressants and atypical antipsychotics can be prescribed, like SSRIs. For Janice, her doctor ordered a low-dose Lexapro, 5 milligrams, to help her with this, and other alternative medicine or alternative therapy. They were talking about vitamins. Lots of vitamins has been mentioned, but none of them really have shown treatment per se. Education, patient education, really these are some of the things that Susan can do, for example, as a daughter of this patient, to help herself prevent AD from happening to her. It doesn't mean that her mom and grandma has it, she's going to have it. However, this is a good way to do that. So some of the stuff, they're talking about cardiovascular health, Mediterranean diet, cognitive activities like learning a new language or other things helps improve this or decrease prevent it from happening. But strategies help with Janice is memory aid, like calendar, nutritional support, physical exercise, cognitive activities, safety precautions like removing clutters around the house, maintaining a calm environment, and promoting sleep hygiene is very important. Prevention, but also for progression. Social interactions like adult daycare, coping strategies for patient and caregivers. This is a very stressful, very sad diagnosis, and is very hard for caregivers to care for someone that has AD. Resources available. Alzheimer's Association has a 24/7 line that a live person helps, whether you are just diagnosed with this disease or you're going through the different stages or navigating what can I do, or can I do for my loved one. Alzheimer's Association is available. Songs and Smiles, American Brain Foundation, National Institute of Aging, Senior Life Style has 50 essential dementia resources. And these are my references. And I really appreciate your listening to my presentation.